So in this question, said pegged red blood cell have been prescribed for a female client with a hemoglobin level 7.6 gram per DL. So a patient has a hemoglobin is less, so doctor prescribed the pegged red blood cell because of anemia. It is very important. Every student must know, and it make easy for you from today. If anybody hemoglobin is less, hematocrit always also less, will be less. If hemoglobin is more, hematocrit also will be more. Okay, hemoglobin is a concentration of hemoglobin inside the red blood cell, and hematocrit is the total volume of red blood cell. So second part, the nurse takes the client temperature before start the blood transfusion and found 100.6 degree Fahrenheit. So my friend, doctor prescribed for the blood transfusion, but as a RN, it is my responsibilities to check the vital sign. If I see the vital sign is okay, I do not have any problem to start the blood transfusion as prescription. But when I see the vital sign is not okay, definitely I have to hold. I should talk to the doctor about the patient. And you see the blood body temperature is 100.6 degree Fahrenheit and Celsius 38.1 Celsius. But the normal body temperature is 37.5 degrees Celsius, right? So now what is my responsibilities? Should I begin the transfusion as prescription? Definitely no. Admin and antihistamine and begin the transfusion? No, I am not a doctor. I can't start any medication without prescription. So 2 is not an answer. Delay hanging the blood and notify the healthcare provider. Definitely. Vital sign is not okay. My responsibility to inform the doctor. Then admin 2 tablet. Definitely I will not do this, right? So hold it and talk to your physician. That's it. So go and rationale. If the client has a temperature is higher than normal, and I said it is normal is 37, the unit of blood should not be hanging until healthcare provider is notified and has the opportunity to give the further prescription. Okay, so we learn it. So every student must know what are the blood transfusion reaction, but this patient problem start even before start the blood transfusion. Questions say the nurse has received a prescription to the transfused a client with a unit of pegged red blood cell. Before explaining the procedure to the client, the nurse should ask which initial question first. Everybody know, I believe, right? What we can do first. I said before start the blood transfusion, we must check the vital sign. But before vital sign, when you talk to the patient, you ask them, did you do you have any history of blood transfusion before? Blood transfusion before? If they say yes, I have, or I had it, then ask any transfusion reaction is occurred. But if your patient do not know what are the blood transfusion reaction, you tell them after taking if you have any blood transfusion history, after took the blood transfusion, did you have any restlessness, nausea, shortness of breath, fever, chill, or back pain? If they said no, I did not have, then it is no transfusion reaction occur. If they said yes, after transfusion, I had shortness of breath, my body temperature increased, I started the tightness in my chest, means transfusion reaction occurred before. We do not give them blood transfusion. So which is the most priority question? Have you ever had a transfusion before? Definitely it is. Already we found the answer. Let me read next to. Why do you think that you need transfusion? Definitely any question asked by why, it is not an answer. It is not a professional communication with the patient. Have you ever gone into the shock of any reaction in the past? Number three, minor chance. It is a good question, but patients do not know what is shock. They are not RN like you. They are not doctor like you, right? And also question number one is super important than number three. Do you know the complication and risks of transfusion? You can educate them what are the reaction or sign symptom occur, but before the number one, any history of transfusion is most important, right? So rationale. So I believe every student already know from my explanation. Still, let me read anything. Read it. Asking the client about the personal experience with the transfusion therapy provide a good starting point for the client teaching about the procedure. Questioning about the previous history of shock or knowledge of complication and risks of transfusion is not a helpful because it may elicit the fearful response from the client. Anxiety will increase, right? But it is the tools of education, it is the tools of good communication. But past medical history is super important for the patient, right? So let me go the next question first. So next question is here. So the client is receiving a transfusion packed red blood cell and that begin to vomit. The client blood pressure is 90 to 50, 90 over 50. So systolic is 90 and diastolic is 50. Both are less. Hypotension, right? Also vomiters. So also they say the client blood pressure is 90 over 50 millimeter of mercury from a baseline of 120/78 millimeter of mercury. The client temperature is 100.8 or 38.2. Also the baseline from 99.2. The nurse determined what are the client maybe experience with complication of blood transfusion, right? So this is the clinical question. It is very clear that when a patient receiving the blood transfusion, after the transfusion or beginning, just after starting the transfusion, patient start the vomiting, blood pressure drop, and also body temperature raise. So all of this actually the sign with the transfusion reaction. But keep in mind, if patient do not the sign and symptom, like I said this clinical question, imagine not a transfusion, but if the patient have all of this sign, right? So this is the complication basically. So the nurse determined that the client may be experiencing which complication of blood transfusion, which complication, right? So septicemia, if patient have it, they have the, basically you have to know what are the septicemia. Septicemia means infection of the blood. When septicemia is not treated, they lead to the shock. And the sign symptom of septicemia or shock are blood pressure go down, temperature go up, and also other sign symptom we can see the vomiting, diarrhea, and also hypotension already mentioned there, right? It is typical sign of septicemia, basically. Hyperkalemia. It is not a anything talking about the abnormal heartbeat, nothing related arrhythmias. Circulatory overload. There are nothing talk about the edema or nothing talk about the shortness of breath. So also delay transfusion reaction. It is even not like this. So most feature related or supposed to be the sign of septicemia. So what is their explanation? Let me explain. Septicemia occur with the transfusion of blood contaminated. So maybe the blood transfusion is occur, it was contaminated because of the tubing or because of the handling, right? So contaminated by organism. The sign include chill, fever, vomiting, diarrhea, hypotension, and development of, it is the sign of shock. Hyperkalemia causes weakness, paresthesia, abdominal cramping, diarrhea, and dysethmia, major dysethmia. But in this question, nothing related dysethmia. Circulatory overload can cause cough, dyspnea, chest pain, wheezing, tachycardia, and hypertension. The delayed transfusion reaction can occur day to years, not a, you see the question said, begin to vomiting. So when you start the blood supply, then start it. It is nothing related to delayed transfusion reaction, right? So this is not a question only. There's so many good information in this question from rationale. You need to know hyperkalemia related to arrhythmia, dysarrhythmia, circulatory overload related to the shortness of breath, edema, right? Also, wheezing, add a sound, and septicemia related to the hypotension, increase the body temperature, and also vomiting, diarrhea, or chill. The question, the nurse determined that a client is having a transfusion reaction. After the nurse stopped the transfusion, which action should be taken next? Very good question. Wonderful question, right? You give me transfusion to me. After, when you see the transfusion reaction start, right? Like low back pain, chill, fever, elevated temperature, tachycardia, as a RN, you stop the immediately. But what next? What next? Next, give them saline solution, right? So saline solution, I said, it is the note every student must know. So they said, which action should be taken next? Remove the IV, do not need to remove. Run a solution of 5% dextrose in water. Run the normal saline. So 3 and 4. But notice here, immediately stop the respiration, transfusion, then hang, run the normal saline that hang with the blood. After normal saline, then what do? Check the vital sign. After vital sign, what you should do? Inform the healthcare provider. After healthcare provider, what you should do? Make sure urine and blood culture are done. So this is the step-by-step process every RN is supposed to do, right? So let me see their explanation. If the nurse suspect a transfusion reaction, the nurse stop the transfusion and also infuses normal saline, right? And then inform healthcare provider. This maintain the patent IV access line. Also aid in maintaining the client intravascular volume. We can check the vital sign as well. And because then there would be no IV access route. Obtaining a culture. Why we do the culture? Can see any kind of organism is there, or what if patient need, what antibiotic need, right? So I said, after all of this, make sure urine or blood culture are done. That's it. So in this question, say the nurse has just receiving a unit of pegged red blood cell from blood bank for transfusion. The nurse is careful to select the tubing specially made for blood product. The knowing that this tubing is manufactured with which items. Click on the image to indicate your answer. There are 4 options. Number 1, 2, 3, and 4. First of all, number 2 is not related to this question, just showing the regulator and some channel. And number 4 is a micro drops. It is not related to anything about micro drops. So now question 1 and 3. But here I said we are learning, right? We're learning here when blood transfusion need, always we can check the any kind of filter is there or not, because the line filter can check if any bigger organism is going through, they can hold it, they're not allowing to passing by. So we learn here for blood transfusion we need a line filter. So number 3 should be the answer, because line filter is there. So let me read. So the tubing used for blood transfusion has an line filter. The filter helps to ensure that particles larger than the size of the filter are caught in the filter and are not infused into the client, right? So here the tubing number 2 is not a correct answer. Number 4 is a micro drop, not a appropriate for here. And also the ear band number 1 is not unnecessary. So 1 is filter line is important here. So next question. Let me go this one. The client has receiving a transfusion of platelet, right? Some of the patient need platelet. The person who have a clotting defect or clotting disorder, or if your patient do not have enough platelet, that times too much bleeding occur, you need to platelet transfusion. So the nurse evaluate that the client is benefiting most from this therapy if the client exhibit which findings. As I told you, some patient need the transfusion red blood cell who has anemia or hemoglobin less. But if any patient has a clotting defect, bleeding disorder, or platelet is less, you have to give them platelet, right? So if you see the any kind of bleeding tendency, so if you see any kind of bleeding tendency, right, like petechia or ecchymosis or any bleeding in mucous membrane, blood is not stopped, they need it. So they said most of this therapy the client exhibit which findings? First of all, increase the hematocrit level, not really. Increase the hemoglobin, not really, because it is not a red blood cell, platelet. Decrease the elevated temperature to the normal, not real, no relation with this. Decrease the oozing of blood from puncture site and gum. So platelet stop the bleeding. So definitely everybody agree with me, answer should be 4. Let me read the rationale if it can help. Platelets are necessary for proper blood clotting. The client with insufficient platelet may exhibit the flank bleeding or oozing of blood from punctured site, wound or mucous membrane. Increase the hemoglobin and also hematocrit level would occur when the client has receiving the transfusion of red blood cell. An elevated temperature would decline to the normal. So nothing that much important. We already found the bleeding tendency, right? So it is increase the platelet can stop the bleeding, right? Decrease the oozing of blood. So the next question is here. So they said the nurse has obtaining 1 unit of blood from blood bank and has checked the blood bank properly with other nurses. So we told you when I need to blood transfusion, always 2 RN supposed to be check it, right? At least 2 RN, check it. So just before beginning the transfusion, the nurse should assess which priority. So I told you, definitely we took the signed written consent form, but when written consent, patient is agree, blood is bring from the blood transfusion, we are RN can check it before infusion. What we have to check? Simply answer vital sign. Take the vital sign. So I said, NCLEX board asks, what must be done to determine the client's baseline before starting the transfusion? Answer is vital sign, right? Priorities: vital sign, skin color, urine output, lateral hematocrit level. So basically, vital sign is answer. So here, a chance in vital sign during the transfusion from baseline may indicate that a transfusion reaction is occurring. So this is why the nurse assesses the vital sign before procedure and again after 15 minutes. And I said, always we will be with the patient after transfusion at least 10 to 15 minutes to check any kind of blood transfusion reaction or not, right? The next question is here. They said, the nurse has just received the prescription to the transfusion 1 unit of packed red blood cell for an assigned client. What action should the nurse take next? So after receiving the prescription, the patient who need transfusion, what we have to do, right? What we have to do? What are the first action we should take first? So check the site of vital sign. It is important, but what are the before to do? Order of blood from the blood bank. Obtain the site standard for blood administration tubing. Y stent. Check to be sure that consent from the transfusion has been signed. First of all, I need the doctor prescription. I need the patient is agree, give their consent. We said written consent, and that must be signed by the patient. When blood is ready, we check it, and before infusion, check the vital sign. So in this question, our next steps, check the sign, consent for the transfusion has been signed or not. So let me read their explanation, what they said. After receiving the prescription for a blood transfusion, the first action the nurse should take should be checked to be sure that the consent of the transfusion has been signed by the client. If the client has consented, the nurse should then check a set of vital signs to be sure there is no contraindication for transfusion at that time, right? They just explain what vital sign: elevation of temperature. If the vital signs are acceptable, the nurse can then just go for the next steps of blood transfusion. The next question is here. They said the following infusion reaction. Infusion of a unit of packed red blood cell. The client has developed new onset of tachycardia, rebound pulses, crackles means added lung sound, and wheezing. Which action should the nurse implement first? So my friend, let me read this question one more time. Following infusion of 1 unit of packed red blood cell, the client has developed new onset. So new onset of some of the sign symptom like tachycardia, rebounding pulse, and also some added sound in the lungs like crackles or wheezing. So all of these signs developed after the transfusion, and this is the sign of fluid overload because of wheezing, crackings, right? So in that scenario, What action should the nurse implement first? Okay, so keep in mind the problem related to the respiratory system. Maintain the bed rest with legs elevated. Place the client high faller. Increase the rate of infusion. Definitely no, not an answer. 1 or 2. Definitely 2 is the best. What about the 4? Consult with the healthcare provider. We must do this. But our first priority, give them comfortness to the patient, right? And this is the high faller because my patient has a shortness of breath, added sound in the lungs. We give them high faller, facilitate first, then go for talk to the healthcare provider. After then, keep the documentation. So the new onset of tachycardia, bounding pulses, and crackles and wheezing post-transfusion is evidence of the fluid overload, a complication associated with blood transfusion. Placing the client in a high faller position will facilitate the breathing, means patient feel comfortable, and then go for talk to the healthcare provider. Let me go the next question here. The nurse listening the morning report, learn that the assigned client receiving a unit of granulocyte that previous evening. The nurse making a note to assess the result of which daily serum laboratory study to assess the effectiveness of measurement. So you see, this is very easy question because in this question you have to find out what are the keyword. The keyword is here, the assigned client receiving 1 unit of granulocyte. So granulocyte is a white blood cell. Granulocyte is a one type of neutrophil, right? So it is easy. Laboratory study assess the effectiveness of transfusion. Which one is granulocyte here? Hematocrit, definitely no. Erythrocyte is a red blood cell. Hemoglobin is one of the molecule inside red blood cell who carry the oxygen. But granulocyte is a white blood cell, definitely white blood cell. Let me read their explanation. The client who has neutropenia may receive transfusion of granulocyte. So neutrophil, one type of granulocyte or white blood cell, right? So this client often have severe infection and are unresponsive to antibiotic therapy. The nurse note the result of the following follow-up of WBC. So when patient have infection, WBC must be go up, especially neutrophil, and it indicate your patient have a infection. So the nurse note the result of the follow-up WBC count, also differentiate to elevate the effectiveness of therapy. The nurse also continue monitor the client for sign and symptom of infection. So means we can check the patient have any kind of fever, right? Or vital sign we have to check. So this is the answer is the white blood cell.